Gentlemen, picture this. Imagine waking up tomorrow with the kind of natural firmness you haven't felt in years. No medications, no mechanical devices, no risky procedures. Just your own hands and a few minutes of targeted stimulation that reactivates your body's built-in erection system. I'm Dr. Sophia Carter, a urologist with over a decade of experience helping men restore their sexual health. And today I'll be walking you through 3 powerful pressure points on your manhood and surrounding region that can reignite morning erections by boosting circulation, relaxing the right muscles and sharpening nerve sensitivity. If those automatic morning rises have been fading, don't go anywhere. By the end of this video, you'll know exactly where these points are, the safest way to stimulate them, and how often to practice for real, lasting results. But before we dive into the how-to, you need to understand why this method works. Because once you see the science, you'll realize you're not simply pressing on the surface. You're tapping directly into one of the body's most finely tuned systems. Erections don't just happen randomly. They're the outcome of a complex coordination between the brain, spinal cord, blood vessels, nerves, and muscles. It begins with nerve impulses, rapid-fire electrical messages sent from your brain or sensory nerves to erectile tissue. These signals instruct the smooth muscle inside the penis to relax, allowing blood to surge into spongy chambers known as the corpora cavernosa. As these chambers fill, veins that normally carry blood away are squeezed shut, locking the blood inside and producing rigidity. But aging alters this delicate balance. Over time, blood vessels in the pelvic area lose flexibility, often from wear and tear, low-grade inflammation, or conditions such as hypertension. At the same time, nerve signaling slows, meaning those electrical messages aren't as fast or strong as they once were. This combination, reduced circulation and weaker nerve communication, is one of the biggest reasons morning erections decline after 50 or 60. That's where targeted pressure point work comes in. By stimulating key areas, you send an immediate wake-up call through your nervous system. Pressing or massaging these spots activates clusters of sensory nerves that feed into reflex circuits tied directly to erection control. These signals don't just stay local. They travel up to the pelvic nerve plexus and even the sacral region of the spinal cord, which houses the erection center. This sets off a chain reaction. Smooth muscle relaxes, arteries widen, and blood flow increases. Some points also influence the pelvic floor muscles, the supportive hammock that helps maintain erections and control ejaculation. Working these areas strengthens muscle tone and responsiveness, making it easier to both achieve and sustain firmness. In short, pressure point stimulation bypasses some of the age-related slowdowns, giving your erection system a direct reset. Done consistently, it retrains erectile reflexes, improves blood vessel flexibility, and heightens nerve responsiveness over time. The first area to focus on is what I call the base groove, found right where the shaft meets the pubic region. To locate it, run your fingers along the underside of the shaft toward the body until you feel a natural groove or indentation. This area often feels slightly different, almost like a hinge where deeper structures anchor into the pelvis. Beneath this spot lies a dense network of sensory nerves, including branches of the dorsal nerve, plus blood vessel junctions feeding directly into erectile chambers. Think of this as a command center where nerve and circulation pathways meet. Stimulating it lights up both systems at once, improving communication between your brain, spinal cord, and manhood. To work this spot, place your thumb on the groove with your fingers supporting the shaft. Apply moderate pressure, enough to feel the tissue but not to cause discomfort. Move in slow, steady circles, gradually increasing firmness as the tissue relaxes. You may feel warmth, tingling, or fullness developing, clear signs that blood flow is improving and sensitivity is waking up. If nothing happens at first, don't worry. Regular practice heightens responsiveness. Aim for a daily session, ideally in the morning before getting out of bed or during a warm shower. Over weeks, this simple habit retrains erectile reflexes and brings back the strong morning erections you thought were gone. The second pressure point is slightly more hidden, the perineum. This is the soft area between the scrotum and the anus. While often overlooked, it's a powerhouse when it comes to erection strength because it sits directly above the bulbospongiosus muscle. This muscle is part of the pelvic floor and plays a critical role in trapping blood inside the penis once aroused, acting like a natural clamp. With age, this muscle can weaken, making firmness harder to maintain. By pressing and massaging the perineum, You reflexively activate this muscle, essentially giving it a workout without even doing traditional Kegels. To try it, sit comfortably or lie back with knees slightly apart. Using your index and middle fingers, press gently but firmly into the center of the perineum. Move in slow, deliberate circles, keeping pressure steady but never painful. You may feel warmth radiating forward or subtle pulsing as circulation improves. Spend 2 to 3 minutes here, and for added benefit, combine it with light pelvic floor contractions before or after the massage. Over time, this strengthens muscle function, making erections fuller and more dependable. The third and final point lies in one of the most sensitive regions, just beneath the head of the penis along the corona, the ridge where the head meets the shaft. This area contains a high concentration of sensory nerves responsible for sending arousal signals to the spinal cord's erection center. Stimulating it enhances nerve responsiveness, helping arousal transition into full erections more efficiently. But control is key. Too much pressure here can overwhelm the nerves. Instead, gently pinch the ridge between your thumb and forefinger for about 5 seconds, then release. Repeat this hold and release action for about a minute. Afterward, switch to slow circular motions around the circumference of the corona for another minute, stimulating nerve endings without causing irritation. Done consistently, this reconditions the nerves, improving both morning erections and overall sensitivity during intimacy. For best results, treat these 3 points as a single daily routine. Start with the base groove for 90 seconds using circular motions. Move to the perineum for 2 minutes, applying steady pressure and massage. Finish with the corona for 2 minutes, alternating between holds and gentle circles. This sequence stimulates circulation, engages pelvic muscles, and sharpens nerve pathways, the 3 pillars of firm, reliable erections. Now let me set expectations clearly. This isn't a magic switch that transforms things overnight. Your body needs time to adapt, to retrain blood vessels, muscles, and nerves to work in sync again. But many men begin noticing subtle improvements within 2 to 4 weeks. Increased warmth and fullness in the mornings, firmer erections that last longer, and a general sense of renewed vitality in the pelvic area. For lasting results, pair this with healthy habits. Stay well hydrated, practice regular pelvic floor exercises like Kegels, and focus on circulation-friendly nutrition. Combined with the pressure point routine, these changes reinforce each other, multiplying the benefits. Over time, your body remembers how to function the way it once did, naturally and reliably. Gentlemen, weaker or fading morning erections don't have to be accepted as inevitable aging. Your body is still capable, it just needs the right stimulus and support. By practicing these 3 pressure point techniques daily, you can retrain your nerves, restore blood flow, and regain that confidence. All without drugs or invasive treatments. Make this a part of your routine, stick with it, and watch the improvements build week by week. And remember, sexual health is closely tied to overall health. So every step you take toward better circulation and muscle tone pays dividends, both in the bedroom and beyond.